membrane right there. It's not a big one, but it's still a membrane. So then, now remember how I told you they stick to the walls? So we need to remove it off the wall. So I take this flat instrument, I push it right up against the sides of the tube like that, go all the way to where it's at, and move it around like this a little bit. Once I feel like it's freely moving, you pull that off. I set it back down, grab tissue forceps, your scissors, and I'm going to go down all the way and pull that off. Okay.
Oh.
See that?
Yeah.
Oh, it broke a little bit.
Oh.
There it goes. Okay, good. You want to pull it right where the red starts, and you want to cut it right at the red. See the red? Cut it right there. Bring it back in here, and that's it. It's a small one, but it can still work with it, right? If you would have opened the lids, it probably would have been bigger, because it would have been a little more clotted. Same thing with this one, still kind of soft, right? So before I take it off, I take my instrument, go right at it, at the side of it, and just dislodge it. Just go around like that once. Put it back. Okay, take this off. Go down to the buffy coat. And pull that one off. Right there, and then I cut it right at the red. And put that one. See how they look congealed? Take your lid, put that on top. Take your other lid and put that there. Now you can wait 1 to 2 minutes, or if you're running, take this in your hand and just slowly push. A few seconds. And open it. And there it is. They're already done. See how fast that happened though? I didn't have to wait 2 minutes and they're already flat. So you can do that. It's like a little trick to make sure you can do it faster than having to wait too long. But look, now they're nice and flat.
That's so little.
So I take one of them. So if we were doing a graft, you would take one, chop it up, and make your sticky ball. The other one we'll put on top of that, of the membrane. But because this is for just illustration purposes, I want to make a good sticky ball, so I'm just going to take one of them. Then we're going to chop up the membrane. And all you do is you take your scissors, and you're going to cut it into a bunch of little pieces.
Pop it off, I guess, the lids. Afterwards it's too important.
That's why I said that's the best way to do that, because sometimes, you know, the tubes themselves don't clot as fast, but if you just do that, it will make sure you get a nice clot every time.
So I guess during the course, someone popped it before they did that, because it was like
it was
so
really
fast.
big, right?
Yeah.
So now look, you have a little bit of liquid, right? We add some bone. And depending how much you're doing, that's how much bone you want to add. I'm not going to add too much so you guys can practice. Okay? Then you're going to take the instrument and you're just going to mix everything around. Right? Get all those bone particles mixed in. Like so. And then usually I kind of like condense them all in one area. Like so. Okay. Then I put this over here, right? And I take one of those syringes. Now remember the one that we took the top portion of? The buffy coat, or the rich layer zone of cells, is still in there. So I'm gonna go back into that with my syringe. Now to get to that, I have to remove the cap. Otherwise I can't get there. The needle is not long enough. So now to get down there, I'm going to take my needle and I'm going to go down to the buffy coat. Where do you want to put your needle? See the tip of the needle there? I usually take it down and I kind of touch the red. See how it's kind of the tip of it is touching the red? Once you're down there, right at that junction, start drawing. It's okay if you get some red. See how it's red? Now it's kind of like orangey or bright red. It's not really dark red. You never want to have just red. It's okay if you get a little bit of red, but not all red, okay? Then this is pretty much done. We take this liquid now, and we're gonna add that liquid to our bone graft here. There you go. Then, you see all those little particulates that are floating? I just kind of compile them, all those, into the area like that. Condense them down and make sure that they're all floating in there.
Oh, it's actually already.
Now look, we leave that 1 to 2 minutes and it's gonna clot. If I try to move this together though, see how it kind of moves together already?
Yeah.
And it's only been a few seconds, like I just mixed it. That's how fast that sits. And once it's set, it can last 4 hours like that. Okay. So now sticky bone is pretty much done. I just let it set a little more so it makes a stronger clot, but it's pretty much all done already.
How much like do you usually get when you try to get buffy?
1.5.
1.5.
So just like up to like right there, 1.5. And then I should try to cover everything up. Now these tubes that we removed the membrane from, they're done. We don't need those.
Yeah.
We took anything good that was in it. Okay, it's already time. Now this, see how that looks now that it's been cooked? See, this one's for the membrane, so we didn't took much of the air out. See, still some air in there. Perfectly fine. We're not gonna inject this. We're just gonna make the membrane. So I take. Now touch how hot that is.
Yeah,
So
hot.
that's why when we're making fillers, we want to cool it because that temperature will kill the cells. Okay, but since we're not making fillers, we're just gonna make a membrane. I'm gonna pour it in here. See how it looks kind of fat? It's like fat cells. Okay. You take then one of these pluggers, the really big one, and all you're gonna do is just kind of condense the PRF down, right? Condense that gel down, just to get an even coverage of this whole area. See, I'm not pushing hard. I'm just kind of gently spreading it around to make sure it gets coverage, like so. Okay. Then I take another syringe. You're gonna find you use a lot of these. Good thing the box comes with 100 of them. Okay. Now, because I want this to clot as fast as possible, I need to get some proteins that help clotting. Those proteins are called fibrinogen and thrombin. They're proteins that the platelets release, right? And they help initiate clotting. Now those proteins, because they're proteins, they're a lot lighter than any of the cells. Where will those proteins be? Where do the lighter stuff go? To the very top. So to make this membrane, what I'm going to do is I take this off. Right. I'm first going to get those proteins, so I'm first going to go down to the very, very top. See where I'm at? I'm going to drop 0.5 cc's of that liquid. See? Then I want all the healing and growth factors of the blood, so I'm going to go down to the Buffy coat, about right there, and I'm going to go draw another 0.5. See that? So that's about a 1.5 of liquid, right? Then I take that liquid and I'm gonna hydrate, just like I did with the sticky one. I'm gonna hydrate the membrane. So all I do is I add a few drops of liquid,
Sorry, how much was that in total?
like 1 cc.
Okay.
You don't need all of it though. I only just put enough liquid to just get an even coverage of the whole area, like that. Okay. Now you wait that 1 minute, 15 minutes I mean, and that's gonna set, and that's gonna be your membrane.
Because during the course you talked about putting this in an incubator. This in an incubator.
This whole tray, yep. The incubators, you know, they're I think they're reptile incubators or something. They're good for when you're doing a lot of these procedures, because instead of waiting 15 minutes, the incubator will help it clot within 10 or 5 minutes, depending how fast the patient can clot. So they help with clotting, definitely. Or like these weren't clotted yet, I would have just put them in the incubator.
This is taking too long. Because people don't show up when they say they're gonna show up. Sometimes, you know, they show up late or something, then you can.
Yeah. Now look, now this has been there 10 minutes. See how this one doesn't have air? Because this one, since we're gonna fill, we took all the air out, right? So now this one, because again, it's really hot. I can't add cells to it because it's gonna kill them. I'm gonna put them in the cooler to bring the temperature down. You never want to do that when you're making membranes though. Because the reason why we do that is because in PRF and facial injections, or that's for a filler, we want that to stay liquid so that we can inject it in the face while being liquid. We don't want it to clot. If I put the gel that I was going to use for the membrane in the cool though, what that's going to do is that's going to slow down the clotting. So now this, instead of taking 15 minutes to clot, now it's going to take 20-25 minutes because I slow down the clotting process. So that's why I didn't put this one in the cool. That one, yes. So anything surgery wise, we don't use the cooler. Facial aesthetics, we use the cooler. Okay, now after a few seconds, it's still kind of warm. Not yet. We gotta wait a few minutes. But look at this one.
Oh,
Nice.
that's good.
That's just sticky. See, and you can pick it up and you can mold it. See, if I want to make like a little cylindrical shape, you can. That's why I said it's like Play-Doh.
It's okay. How fun.
And to do your grafting, you just grab a piece, put it in the socket, pack it, off you go.
젤리 같아요.
So much like control over them. This powder like flying all over the
Mm-hmm. Do you still do that? Hydrate your bone with saline? Yeah. And then when you're packing on maxillary ones, it gets really difficult. Okay, now this has been a few minutes. Touch the difference now. You feel that? Now it's cold, it's no longer hot.
Okay.
Okay, now we can take this out and we're gonna draw up the liquid from this one. Okay. So now I get another syringe. Right? And then we're gonna draw up the buffy coat to add all those growth factors to the filler to help with collagen production, right? So to do that, I'm gonna have to remove the lid again, right? Then we're gonna go down to the buffy coat layer. Now, fillers are okay to get some red. If this was a microneedling one, you do not want any red, okay? Okay, see I got 1.5.
This one you didn't really go near the red area.
Not as much. In facial aesthetics, you don't want to get too much red. Because redness in the face can cause hyperpigmentation. That in dentistry, you know, we put it in the oral cavity, nobody's gonna know. So then the air, we have to get all that air out. So I get the bubbles out. If you get like a stubborn bubble doesn't want to come up, you can hit it on the counter and it'll come up. Then you push the air out. I always get more than one just to make sure I get all that air out, right? Take off the needle.
1 cc.
Uh-huh. Then we put our female lower lock. Connect it to one end. Take off the other top. And then you push any remaining air that might still be in there all the way out. See? Take that off. Okay. Make sure there's no air. Then we take the cap of this one, push some of it out. Make sure there's no air. There you go. It's very thick, so it's kind of hard to. Then you connect them like so, and you're gonna start mixing. So then I mix the solid into the liquid. And then just go back and forth. Ten times. 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Now, see how I'm mixing it kind of fast, but not too aggressive. You don't want to be like, because then you can damage cells. So now I said 10 times, but if I started doing this before the doctor was ready for the injections, I have to keep doing this until she's ready for the injections. If you stop, it's going to clot and then you can't inject it anymore.
What needle do you use to inject it with?
25 gauge needle. We don't have them here, but I think you can order them.
I'm gonna inject you. I guess not.
You're going to inject for real?
I was gonna inject it.
Yeah.
Oh, for liquid injections, we need the 30 gauge. Okay, look, now after you do that, because the ratio is 1 to 2, you can just even it out right at the 1.5 mark. Right there. Right? They're nice and even. Take off your cap, and then you can inject that. And that's how the filler looks. See how it looks nice and broken down? So if I was doing 2 temples, there you go, that's the 2 temple injections.
Nice.
And there you go, that's your fillers.
Nice.
Alright.
This was just extra?
Yeah, because I just drew a little extra just in case I need it. But like I said, if you're just doing dentistry, 2 and 2, or you're doing fillers, you just need 2. Technically, you could get away with just doing 2 for fillers. But if we do microneedling and fillers, I'll do 4. Yeah. And now that, I don't think that one's ready yet.
For micro needling, you just get the liquid part, you put it on the face, and then you do needling at the same time.
So to draw that liquid, I will actually, because we have that extra, I can show you. I have a little trick for microneedling to draw. Microneedling has to be very careful. You don't want any red. If not, your patients will bruise. So because we only want the buffy coat, a trick I have to draw the buffy coat without drawing red, you take your needle, you're going to put it angle. See how it's at an angle? You're going to go down all the way to the cap here stops you. See where that cap stops? See where my needle is?
Yeah.
That's where I'm going to draw. So I usually anchor it against the cap like that, right? And then I start drawing. And when I draw, I swirl. See how I'm swirling my syringe? Just to make sure I get all the buffy coat. And I can't go any lower because remember my needle is stopping. And then I go as much as I can get. I got 3 cc's there. No red at all. Okay. That's kind of what you want to do when you draw the buffy coat. Otherwise, you
Good
get
stuff.
that. You can actually apply this in your face as like a.
Why?
Like
No.
I know.
It's good.
Yeah.
Put
Let me
it.
take it.
Put it on you.
What did I do with the lid? You want it for real?
Seriously, put it on. Go to the bathroom and put it on. It's good. Why waste it?
Don't waste my blood.